We will share all presentations of the webinar with you. So this is one of the weekly webinars that EASPD has been organizing since the beginning of the Corona crisis. And I'm sure that at the end of the webinar, Luc Zelderlo, Secretary General of EASPD, will give us some outlook on the next webinars that are planned. So now just imagine, we have more than 500 registrations for today's webinar. So I think this indicates quite clearly how important this topic is for all of us at this moment. A recent snapshot report of EASPD, it showed that residential services stayed open in most countries, but that many other services have been closed during this period. For example, day services and workshops, training, respite care, or early childhood intervention services. And now that our confinement restrictions in our countries are slowly being lifted, we face many challenges on how and when we are reopening our services. My organization, for example, it operates in the Salzburg region in Austria, and we just started 2 weeks ago with a multi-stage process, so we can reach the full and normal operation of all our services. And our strategy, it has been developed in cooperation with the authorities and with other regional service providers, and this was very helpful for us. In this way, we could and we can address many important issues, not only on the level of our organization, but also on the level of the system. So we can also address funding, like guidelines and working conditions for staff, health and safety issues or protective measures. And of course, most importantly, the needs and wishes of the service users. Our strategy also includes monitoring and evaluation, because we first have to gain some experience on this opening up process and have to improve our approaches accordingly. And we also have to be able to adapt to changing situations during this time. And just to share one more thought with you, just last week, we had a discussion in the policy impact group of EASPD. And we said that because of the different situations and different structures in our countries or our regions, it's not possible to develop the one roadmap that would fit us all. But what we found very helpful was to exchange possible answers for the challenges we are facing in finding the right balance between protecting service users and staff, and at the same time supporting empowerment and independent living of service users in the communities. So in this webinar, experts will share their experiences and possible solutions with us, and I think that can help us shape our own local and practical answers to this question. So we have 2 panels. And in each panel, we have 3 speakers. And after each panel, there will be some time for questions. And then in the end, Luc Zelderlo will share his observations and concluding remarks with us. So now it's time for me to announce our first speaker. It's Olivier Cademera. He works for Hubi, which is a Belgian service provider for persons with learning disabilities. And Olivier works as frontline staff, so the experiences and recommendations he's sharing with us are really very practical. So please, Olivier, you have the floor.
Thank you. Let me get my slide here. Hi, everyone. Well, thank you for having me. I'm gonna present myself first and say who I am, and then I'm gonna kind of say what I've experienced in work by working in this situation. So my name is Olivier, and I work as a support worker in a residential home. for people with disabilities, mental disabilities. Um, the organization is settled in Brussels and it's called HUBI, which was known before as...
Olivier, sorry, could you speak a bit louder? People have difficulties to hear you.
Is like this better?
A very little bit. Could you speak just loud?
Okay, well, let me try this. Like this better?
A bit.
Okay, okay, I'm gonna try to speak louder.
Sure.
Okay. So Hubi is settled in Brussels, as I said, and we have different services, which is daycare, residential homes, and support work for people who live at home, but we still give them support. I've been working in the same organization for 8 years now, and I work in one of the residential homes. The capacity of the home that I work in has 30 rooms on 4 floors.
Sorry, Olivier, we have to find some solution because also the interpreters say they can't hear you.
Oh, that's so weird. Even like this, not better? I don't know.
I don't think that your microphone is picking it. You need to talk to the computer or phone directly. There is no difference if you put this microphone closer to your mouth. So I think that's not working properly.
Oh, I tried this before, it was better. How about like this? Is it better?
Yes.
It is.
Okay. So yeah, that's my slide on what I do. So the residential home that I work in has a capacity of 30 rooms on 4 floors. That's one of the residential homes that we have. Then I'm gonna go to this one. So as Karine said, there is in residential homes, it's impossible to close because there is people who live there, and yeah, you can't just close the doors and just let them live by themselves because it's not possible. So we had to adapt ourselves. We had to close the daycare. They couldn't go anywhere there, and we had to adapt the groups because every unit we work with 12 people there, but it was impossible to with the safety distance, it was impossible to stay in the groups of 12 people. So we had to reduce the groups, the units in 6 people. So in half, we have to cut in half. And we took the workers who used to work in the daycare to come give us a helping hand to be able to manage to open five units instead of 3. So it is difficult to secure the safe distance depending on the need of the support that we have to give the people, because well, depending on their disability, they don't really understand the situation, and their need is always, well, the support that we have to give them doesn't allow us always to keep that safe distance between us, which is us workers being aware of the situation, the way it is, the risks there are. And that's why we worked in smaller groups, and that's why we needed material to protect ourselves and to protect them. What can be done to help people benefit? Well, first of all, it is the communication, and where the problem is with the communication with the people that we work with is the fact that everyone has his own capacity of understanding what the situation is, and some of them don't even understand the issue or the seriousness of the let's say of the virus, and so yeah, you have to adapt to each one individual. So you can just write a script on the rules which has to be followed and expect everyone to follow them the same way, because it's impossible. because you have we have people with autism, they have their own schedule in their head. I can give you an example. There is one who always has his routine of going to see his family every Saturday at 12. So for him, telling him no, you can't go, it's something which is really hard. So it's an everyday. Well, he has the capacity of understanding that there is something wrong, but his disability doesn't allow him to accept it. So it's like a repetition every day, even 5 times a day. You have to repeat for him that it's not going to be possible to go to his family. And what we do for them is also being present for them. We have to be there present every day. And the hard part of the thing is like you become the focus points for those people, people benefiting from our support, because they have no other contacts besides us. They only see us where we're at work, so all their focus is on you. So they don't have any work anymore. They don't do any day activities anymore where they used to go before. They don't see their family anymore, which means you become the center of their world, actually. So they all focused on you, and that's a big. It's a lot of. It can be too much sometimes, but yeah, we do it with love, so it's no problem with that. What we do also is try to create a safe and familiar environment. So with activities that we have to create, and the contacts, because yeah, they have to stay in contact with their families, with their friends, with the outside world, the people that they used to know, they used to see every day. So we try like using laptops and everything, calls, writing, drawing, like we try everything. Yeah, just to make them still feel part of to make them feel part of the society still, even if they're locked in. Which brings me to the mindset of us support workers when we come to work.
Olivier, sorry, could you please go to the most important messages that you have for us, because your time is nearly up.
Oh, okay. So yeah, the most important message I have to say is that us workers, we have to know when we go there that the people with support is gonna feed on our energy. So it means if we go there already down mentally, they sense it and they take it. They take it up with them, and it's gonna be harder for them. And what's also important is us support workers also getting support from the managing board, meaning to be heard and to be even given also the time and space to be also just to clear our minds. Where I can also say something is like technology is a part of our society, but still it will never replace the contact, the human contact. So that's why we have to try to find ways to stay, well, to give that human contact, to still keep it in our work. And yeah, as we said, 1.5 meters doesn't seem like much, but still it changes everyone's lifestyle. And we have to keep in mind our people that will work, the benefiting from our services, and also the support workers who have to go there every day. And yeah, and don't forget about them. I don't know how many minutes I still have.
You're over time. I gave you more because of the.
Oh, sorry about that.
So you're fine stopping here?
Yeah, it's gonna be fine. Yeah.
Okay, thanks a lot, Olivier. I think even though you could not share all of what you brought with us, but I think we got a very good insight in what you're doing, and and sharing at the service, and what you have to think about for really taking into account the needs and wishes of the service users in these difficult times.
Okay.
So now we turn to a different perspective. The next speaker we are welcoming, it's William Cockburn. He is from the European Agency for Safety and Health at Work. And I heard that William will share with us some guidelines for staff. William, please. William, you're muted.
Yeah, thank you, Karen. Hello, everybody. I will share my brief presentation just to take you through some of the main points of this guidance for workplaces. Let me see if I can just. Okay. You can hear me okay?
Yep.
Good. So yeah, I'm from the European Agency for Safety and Health at Work, one of the smaller agencies in the EU. We're an information agency. Of course, we take an occupational perspective to the risks arising from the pandemic. So rather different from the public health perspective that we're mostly familiar with. And I think this seminar, which I'm very glad you've invited us to, is very timely and very important. Those who work in support services are really frontline workers. Just the day before yesterday, some very early statistics were shared from the UK, showing that the deaths, analysing the risks of death amongst the working age population and those in social care service actually have a higher rate than the population, and even a higher rate than those working in healthcare. So social care, at least in the UK at the moment, is quite a risky occupation. And at the request of the European Commission, the agency issued some guidelines. General guidelines. I have to say they're not specific to those working in this sector or particularly relevant for healthcare sector. In the context of the return to work, so in many countries we're moving from the public health emergency to some sense of recovering normality in work, and these guidelines therefore are there to try and support that. If I move on to the first slide here, some of the main principles that we are recommending are firstly based on a risk assessment. So that's the starting point in Europe, in all workplaces, for carrying out safety actions for preventing risks to workers. And under this risk assessment, which should be there already, but will have to be revised when resuming services, there are some principles we can look at. One is about planning and vigilance. So employers should be thinking ahead at what the needs are, monitoring, asking employees to look out for symptoms of COVID, being flexible so that these workers stay at home, minimizing the risk of infecting others at the workplace. We're also looking at employers being flexible in terms of leave, taking special leave, and in remote working where that's possible. And also, if appropriate, being able to offer testing that's maybe more relevant for your situations. Then making sure that everybody is fully aware and informed, not only about COVID itself, but also about the procedures that are in place in the workplace, how to act in the case that somebody comes across a suspected infection, who to call, what to do, raising awareness in general. If we come to preventive measures themselves, so prevention of risk of infection, always we have to bear in mind, and this is in the European legislation, occupational safety and health, as well as being good practice, is that collective general measures must come before individual ones. So those include, for instance, hygiene measures. We're talking about everybody using hand washing, which we've heard from WHO and other organizations is the most important, sneeze etiquette, wearing face coverings in the form of surgical masks or hygienic masks, regular cleaning of surfaces and ventilation. So these hygiene measures. Then, as you're all aware as well, the physical distancing measures. So always trying to maintain a minimum distance of 2 meters or 1.5 meters. Where that's not possible, also putting up physical barriers. You'll have seen them in the supermarket screens, separating you from checkout staff, things to stop the virus from passing from one person to another. Then organizational measures. So within this risk assessment, the employer has to look at what services, what tasks are actually non-essential and maybe can be postponed, or maybe they can be delivered using another mechanism. So perhaps some services can be provided remotely, they can be provided online perhaps, rather than face-to-face, or we can change the way deliveries are done or the way we carry out work to ensure that staff are separated. Personal protective equipment in the occupational setting is subject to legislation. It requires certain actions, a formal fit test. So personal protective equipment in the form of masks comes in different shapes, sizes, models. There's a requirement for a formal process whereby staff are fitted to a particular model and they have to receive training on the use of the mask and its disposal. So personal protective equipment comes with some obligations. And then finally, of course, in the general principles, it's important to ensure that everybody is fully trained on these protocols, procedures. If there are new forms of work, also on the new forms of work. It's important not to be giving rise to new risks when we're trying to eliminate the risks related to the virus. Some of the other issues that we address in our guidance are the actions to take if your workplace has been actually closed for some time. So maybe it has been closed for a number of weeks, like we have here in Spain. Then you need to get in touch with your occupational health services, prevention service if you have it. Make sure that you've communicated to staff who are away from the workplace, your deliveries, your contractors, and so on. We have to assume also that there may be quite a high rate of absence. You may have members of your staff who are not able to work because they're sick themselves, because they have a family member who are sick, or because they're self-isolating. So the employer has to be aware that that work shouldn't just fall on the shoulders of other people with no thought about what that means for them. Again, we don't want to be displacing that risk. And some preparedness in cross-training workers to ensure that they can take on tasks. But that's an important issue.
William, sorry, we have 1 more minute, please.
1 minute, yeah, okay. We have a lot of people teleworkers who have not been used to doing that, so special guidance there. It's always important to involve the workers, ideally through their representatives, trades unions, health and safety representatives. And we also give some ideas about what to do if you're taking back an employee who has been ill themselves, and what to do to learn for the future. And I just finally put some questions here. I'll leave them up, I won't go through them, that I thought were more relevant for your setting in particular. And out of these, I would just highlight what, really picking up on what Olivier has said, which is to what extent can you expect the recipients of your services to actually comply with the needs in terms of, for instance, hygiene measures? Can you really expect them to be wearing surgical masks? Can you expect them to maintain hygiene as in terms of cleaning surfaces and so on? So all these should be carried out, should be considered in a risk assessment before you enter and provide services. So those are the main points. Thank you, Karin.
Thank you very much, William. And I must say, I was, from an Austrian perspective, I was both surprised and shocked about the dangers that you were talking about in social care. I think we have slightly different situation. But I think all the more valuable are your guidelines and what we have to bear in mind to reduce risk. So thank you very much. So our last speaker in the first panel, it's Luca Scarpiello. And Luca comes from the European Federation of Public Service Union. And so he will give us a union's perspective on staff, important matters for staff. Luca, please.
Thanks a lot. Thanks everyone for inviting us, because I think also in view of the high toll that our services and our workers, I'm responsible for health and social services within the European Federation of Public Service Union, is actually the high toll that we paid to this outbreak is, of course, for us, it's, let's say, not easy to start again, but we need to do this. And we need to do in a moment where maybe for the first time, the integrity of the workers and the integrity of the user are exactly on the same side. One of the things that also the WHO has in those days shared is the fact that not only that social services, in particular long-term care facilities, but not only, have been, how can I say, one of the biggest springs of the contagion. We have seen also that it's very difficult to stop the outbreak if we are not able to ensure the safety of the workers and of the staff. And therefore, acting on this point means in a way to break the ring, one of the most important ring of transmission of this outbreak. Now, how to start again? Because I think that the restart of the service is difficult, but not impossible. We need to work on concrete guidelines. And I think that one of the things that we are mostly committed as a trade union is indeed to make and to work on protocols that together with employers, I'm happy that we have also together today a number of employers, cooperatives and so on that are working to ensure what are the guidelines. We have already few countries, but also few establishments that are closing agreements with trade unions. And I think that there are few elements that are important to take into consideration. For instance, we have said the use of masks and of protective equipment. On this, let me very clear with you and let me very, very open and honest. I think that it is important that we regulate even further the use of masks. And let me remind you that on a number of establishment workers, in particular in Lombardia, but also in other countries, workers at the beginning of this crisis has been banned from using those masks because they were thought like they were scaring the users. So discipline and also find solutions that allow, for instance, people with disabilities to communicate and also to find suitable ways to ensure communication with the staff is fundamental. On masks, we need also to say that one of the biggest problems that we will have in Europe is to make sure that we ensure continuity in the value chain. I mean, all the sectors today are saying that they need masks, and only, for instance, the country where I come from, we need something like 1 billion masks every month. Imagine and multiply this for all the member states. You see how either we secure the value chain or whoever is saying, but to ensure enable protocols, it's enough to have, we can ensure protective material and so on. It's a false hope. if we don't today structurally improve the production and the distribution of this material, we will never get out of this. We need a test and preventing screening for the staff. We have the same problem in healthcare and hospitals. We are urging the European and the international institution, as well as member states, to ensure as soon as possible the preventive test, not only serological, but also through the tampon of the entire staff. Because if we don't manage to understand where are, and if people is continuing, where are the positives and so on, we will never get out of this. Temperature check, but also another measure that is fundamental. We need the organization of the facilities needs to be reshaped, in the sense that we need to create also, and this was also, I think, in the WHO guidelines, small groups that follows always the same groups of patients and users, because in this way, let's say, we can ensure the team, but also at the same time avoiding that teams are mixing users and are mixing clients. We need to create also different elements that allow, let's say, to circumvent, in case there is an infection, also the contacts and so on. Of course, access to sick pay is fundamental for us, in the sense that we are working in order to ensure that not only that COVID is considered a professional healthcare, and we have different unions that are pushing the European Commission in this directive. We need also to ensure that at the first symptoms, workers can stay in their home, or let's say facility or lodging next to the structure, to the facilities. Because only in this moment, we can make sure that workers that have symptoms are not forced to work and can stay home with the full recovery and all the full salary and so on. We need to avoid that in a sector that has been always plagued by precarious working conditions and so on, people can lose their salary in case they fall infected. This is why, and I hope we can share together this fight. COVID needs not only to be considered a professional sickness, but also it's a shame, in our opinion, that the European Commission, in the framework of the Biological Agents Directive, decided to classify COVID under Group 3, which means that are not the most viral and also the most dangerous agent, but also the problem is that Group 3 are those substances with the clear protocols for infection containment. This is not the case, and whoever say the contrary is saying you a false news. So for
Luca,
us,
sorry, could you please conclude? You have 1 more minute.
Yes, I know. I'm checking. Of course, and this is also something that I'm happy to discuss with you. This costs money. It's not for free. Also because I think that there has to be also an action from the side of the employers and the employee side, because we need to improve not only the safety protocols, but also we need to enforce on a same way also measures like training. New social distances will mean investment in our structures, in our facilities, and so on. So we need not only more staff, but also more training. For this also, funding line that can support facilities, users, employers, and the trade union to found the protocols, and also to found the measures to train more staff for the future and ensure better pay, is for us fundamental. We know that we can count on you. We know that we can count all together to a long-lasting dialogue that we have been put in place so far. And I'm very happy to continue discussing today and in the next days. Thanks a lot.
Thank you very much, Luca. And I think that you three panelists really drew a very complete picture for us of very important issues. I think there was very much overlap on central issues from the different perspectives. And now I would like to ask some questions that came in. I'm not sure, I think that one of the questions would probably address more Olivier. Olivier, the question is, how can transport for service users be provided? Bus transportation, for example, what measures have to be taken? I think that that question means that once you are opening up day services and users have to travel from residential care or from home to the workplace, how can you organize that?
What we do here, or what we think of doing here, is we have traffic service, transport service, which is called it's one of the government's transportations, which work for people with disabilities, and they come, and you have like 2 or 3 people maximum in the bus. It's a large bus, which has like 7 places normally, but normally we're gonna reduce them to 2 or 3 people maximum. The next thing is we also have our own transportations. We'll also have our own transportations, which take 8 people normally, but at that time we're gonna be reducing the number to 3 people also. So just to be sure to have that social distance in the bus. And we also use masks, which are made by ourselves. So each person in our home has like 3. So which means it's a cloth mask. So it means you can only use it once, which means every night we have to wash it with a degree which has to be done like from 60 to 90 degrees boiled. So when they go outside, they use the mask to have that barrier.
Thank you very much.
No problem.
So next we have a rather broad question, I think, or it's a big question, and maybe William and Luca want to have a look at it. The question is, are there any new investment needs that appeared from this situation, this new situation post-COVID? And the examples the person gives is like capital, equipment, training, research. William, do you want to take the question first?
Yeah, I just wanted to mention I've shared the link for the guidance, which I should have said is available in 25 languages. And at the end, there's a collection of 400 links to resources for sectors. And just for health and social care, there's nearly 100, and one's for transport. What investment? I mean, I think from my perspective, I would say that the investment needs to be in preparedness. And perhaps there was not enough thought and updating for pandemic preparedness in general, which then would have highlighted the needs. So for instance, stockpiling of personal protective equipment, already have protocols ready to roll out. What we've seen, certainly in the public health emergency, has been in some cases quite ad hoc solutions, and really rushing to try and fill the gaps. And I think the occupational health and safety approach would be, carry out your risk assessment at all levels, identify what future risks there might be, and make sure you've got the actions and measures and resources prepared in case that risk comes to light.
Thank you very much. Luca, you want to add something to that question?
Yeah, absolutely. Also because I think that there are 2 kinds of trainings that we need to foresee in future. One more connected to COVID, and one very short terms on COVID, in the sense that, for instance, we are putting forward a number of measures, like, for instance, social distancing. We know that from a user side, social distances, which has been severely affected, for instance, by the block of the visit from parents and so on, will mean other means of communication and interaction with users. If I can't stay 1 meter, or if I have to wear a mask, it's clear that I need to find other ways to ensure my support. That many times is also corporal one. So it is important also that on the use of new technologies, for instance, if we want to invest also in televisits and not only visit in person in case in particular of this, we need to make sure that staff are aware, knowing that most of the time we have also in many member states an average of the staff working which is increasing. So not all the people are how can I say, acquainted to this. It's also important, for instance, to have a clear training on the use of the protective equipment. If you don't wear mask well enough, they are pointless. And the same also on the treatments and so on. What does it mean in case of treatments applied to social distancing? How they should act concretely? All those things needs training, and also a second kind of training that is much more longer term. The problem is that, are there preparedness plan? The preparedness plan work like the evacuation of a building on fire. People needs to have clear instruction on where users should be, let's say, led, what are the measures, how to recognize also the measure, and so on. Of course, the difference between the two is that the first one has to apply to the feature of COVID-19. The next one is means that there are, first of all, preparedness plan, points that we already missed after the H1N1 crisis, because we said that there would have been a preparedness plan and no plan were foreseen. This time we want plan, and we want staff training to this plan, and they have to be ready to at least understand and know what's happened since the beginning of the stage. And I finish saying, epidemic works that either not, despite this time, you are able to understand what to do since day one, and you know workers what to do with the people, or we will see the same situation in 5-10 years time. So this is fundamental in terms of staff.
Thank you very much, Luca. So maybe because we are nearly at the end of our time for questions, but we have another question related to training about we heard a lot now. And the question is a bit more specific, meaning that what training is needed for professionals dealing with persons with disability in the social, psychological health sector. Does any of the speakers have anything to add to this more specific question, or do the explanations you gave about training necessities in general also apply for this specific group? Does anyone want to add? William?
I think that it would be useful for people to have some training on how to assess the risks for a particular setting. So here you're describing service provision to a recipient who will present certain challenges, and the training could help the provider to go through all of those, and as a result, take a decision on what measures need to be put in place. So, as we've heard, where physical distancing is not possible, then what measures it? What is the environment like first? What risks are you likely to find there? What can you expect in terms of cooperation or behavior from the person who is actually receiving that treatment? And in the worst case, you're going to have to end up with personal protective equipment, like Luca has mentioned, and it's something that you want to avoid. It's the last line of defense and should be the last resort because of the quality of service, but that's a decision that you should come to following a set decision procedure.
Thank you very much, William. So we have to close, unfortunately, this first round of discussion, but I think it was very interesting to tackle some of the questions more profoundly. And I would like now to open up our second panel after saying thanks to all the panelists of the first one. And I would like to start with Sylvain Renouvel. He is from Nexem, which is a French umbrella organization of service providers. And Sylvain will give us their guidelines for reopening services. So Sylvain, please.
Yes, I'm coming. Hello, can you see my PowerPoint? Yes, I think so. So I'm Sylvain Renouvel. I'm Director of the Open Affairs of Nexem, a French umbrella organization in French social services. And I have also another double hat. I am also the counterpart of Luca, who just spoke in the Federation of European Social Employers. And I would say I fully agree with most of you have said, but the fact together we also had made some actions towards the Commission about the question of masks to ask the Commission to focus on it. So about my presentation, I'm going to say a few words about my federation, about the situation in France, and provide you a few recommendations made, which are a mix of my colleagues' thoughts, some official recommendations, and also the concrete actions from our members. So the first thing, the Nexem, so it's a French organization, an umbrella organization about employers. And most of the members are providing services for persons with disabilities and also other persons in the same scope of social services. And we have 10,000 members from little organizations to big ones as the French Red Cross. And the total, they employ more than 300 employees. About the French situation, I will say, I'll go in the same direction. On the little boxes, you can see the data for France. And you can see that we have almost 140,000 persons infected, and half of them were people living in residential care homes. So it means that there's no surprise when William says that lots of people are infected in social services, because that's also where most of the cases are concentrated. About France, we ended the lockdown last Monday, and then so it's now progressive, and also progressive depending on the regions. As you can see on the map on the right, the red part is the most infected. On the green one is less infected. So you can imagine the progression is not the same where the virus is still active. So about the guidelines. So of course, our main guidelines is to be progressive. Okay for a recovery plan, but not putting everybody at work and all the users present at the same time. That's why we say yes, let's go, but progressively. And the first thing is the first advice we give is to anticipate the needs. And the first thing is to ask the users: do you intend to stay home? If you want to stay home, do you need any specific support? We mustn't forget, but also the families can need some respite, and we also have to ask them if they want to come back full-time, part-time. And the last thing is, do they need some new support needs linked to the pandemic? And of course, we can think about stress that they have been exposed to, and also the stress of going back to collectivity. So we have to anticipate these things. And then if we know how many people will come back, it will be easier to have the staff to work with them. We also have to prepare the premises and the organization. So to allow social distancing, the French authorities says for all the sectors, you need at least 4 square meters per person. It means you divide the superficie of the workplace in, and you count how much workers and people can be in the premises. You must also organize sanitizing and think about little things like, do I have any soap, enough soap? Because we, of course, ask people to wash hands more frequently than we used to. And then we have to anticipate lots of things. And of course, we have to obtain, that's not the less difficult thing to get, and distribute the protective, personal protective equipment as masks, not only once, but in one. We also have to communicate to inform users and the staff about the relaunch of the activities and the conditions. We also, it has also been said, we have to train users and staff on how to use correctly the protective equipment. And for this, I will share at the end, at the last slide, we have the French authorities made a leaflet in easy to read and understand way. That is quite interesting for it. We also mustn't forget that even if the lockdown is ended, cases and infection can appear. So we have to think about it before, so that if one case comes, we have a good reaction and we know what to do. We have to work about the organization. I told it, yes, it has to be progressive. Maybe we can accompany and welcome reduced groups. And we also advise to ask the staff to come back at work the day before or the morning before, so that they all know all the rules and what to do when users come back. We also have to define the offer of services adapted to the needs, of course, because as we ask them, we know what is needed. We need to provide psychological follow-up for users because, as I told you, it could be complicated. Also, think about checking the availability of all partners and providers, because if you open your services and you don't have the transport to take the users back to the service, it won't work. And also, we talked about it, organized transport in secured conditions. And I don't have any guidance, precise guidance in it, but I would say at least half of the capacity that we normally use. We also have to think about—
Can you please conclude, Sylvain?
Yes, about human resources. So we must determine hierarchy, identify the skills, and some people have multi-skills, so it can be interesting for the activity. Anticipate potential overtime, referencing the staff, support for the staff, also for psychological aspect, and manage occupational safety on health at work. It has to be participative. We have to work with workers' representative as also member of the staff and also occupational health services. And to end, I'm getting to the end. We also have to make a follow-up, at least at the beginning, to be able to readjust the functioning and give also feedback to the staff that is aware of what happens and can accompany better the people. And update risk assessment. And the last thing, we must also take advantage of the crisis to think about how to improve safety conditions at work, or also to take stock of new forms of support we provided. Was it remote support? Was it activities outside the structure, smaller groups? Did we have new partnerships and collaborations? And last advice. It's interesting as we do today, to share between providers and colleagues what we learned from the crisis. So I thank you for your attention. Sorry, it has been a bit long, and I will be happy to answer questions. Thank you.
Thank you very much, Sylvain. Thank you very much for sharing. And I think that you have developed quite impressive detail of guidelines already. I think there is a lot of thought went into it. So I'm sure it will trigger a lot of discussion. So I think now we could invite Maja Doneva from Carindom, which is a service provider in Bulgaria. And Maja let me know yesterday that they were a bit lacking guidance of authorities. And so I think they developed an interesting way of decision making in this situation. So I'm curious to learn more about it. Maja, please.
Thank you, Karen. Thanks for this invitation. I'm very glad to be here. I'm very thankful also for the invitation by EASPD, and I hope that I can bring some usefulness to what you can implement while we go back to normality, whatever normality is. So maybe just a brief description. Carindom is based in Varna, which is in the eastern part of Bulgaria. We work with about 300 families per year. So for Bulgarian scale, we are quite large. Our team consists of about 50 people. Mainly we work with children, we work with early intervention, and we hire generally psychologists, physiotherapists, speech therapists, and people who support children's development in different conditions. When the COVID crisis started in Bulgaria, it was declared state of emergency for 2 months since mid of March, as I think in most of the countries in Europe. And this was quite disturbing in the beginning because we were not ready how to digitalize. We were in a way thinking that maybe that's the right step in order to survive and to provide our services. We managed actually, and we managed to cover 96% of our families that we were giving service before. I'm mentioning this because this also is the root of our decision making afterwards. We had a very flexible team, very adaptive, but that was also, as many of the comments mentioned and speakers, leading to a lot of pressure within the team. I mean, this whole stress is stressing not only our beneficiaries, but it's stressing very much also us as people who are grassroots oriented activists, people who support other people. We adopted a really interesting method of decision making in the first middle of the state of emergency. And our decision making currently stands on 3 pillars. The first pillar is the beneficiary's interest, so the families, the children we work with. The second one is the team well-being and mental health, but also ability to actually do their job. Because, for example, you can digitalize a consultation with a parent, but it is really difficult to digitalize, let's call an autism play group of 3 kids. That's literally impossible to digitalize. And the third pillar, of course, after the families and the team, unfortunately, it was the finances. I mean, even though we are very much value driven and driven towards impact, finances is something very crucial. I'm not sure how many of the organizations here and people here are independent NGOs or municipality social service providers. In our case, we're an NGO, so we do a lot of fundraising generally. And fundraising in our situation currently with COVID is impossible. Everybody who is interested in donating is going towards hospitals and medical care, which is absolutely obvious why. But this also leaves a huge gap when it comes to social activities and how they are funded. So this is why we adopted this 3-pillar system. On a practical note, what that means is that we have a strategy which comes from March until September. There were 3 scenarios that we explored, and I think that mostly we're going towards the one that we went from analog to digital overnight. Right now we're still digital, and we're slowly trying to go back to a mixed model between individual meetings, perhaps from mid-June. But again, until September, we'll be mainly going digital and providing online services. We are currently trying to actually start a project that is within our garden to actually adopt therapy sessions on the outdoors, because Varna is quite sunny and very warm. Even now it's like 25 degrees. It's actually very good for going to the beach. Unfortunately, timing and weather are not on the same page, but we're also trying to work with what we have. So adopting a bit more like sessions, maybe individual one-on-one or digital sessions being broadcasted from the garden. So this is something that we are on a practical note exploring currently. I will not repeat everything that was mentioned before regarding masks and disinfectants and all of this. We cannot escape that for sure. Maybe something that you can as well adopt as an idea. I mentioned that within our team, we have about 50 employees. We are a really interesting team because generally we have a team of young parents working for us within the team as consultants. Mainly about 70% of the staff have children under 18, which are also currently under isolation. So the balance between work responsibilities, home responsibilities, and personal life, there is no balance, there is a struggle more than a balance. And we recently took a decision that we would try actually to surprise each of our families of the team members with one dinner per month. And we had really good partnership with one restaurant that we are also supporting in this way because they're also struggling. So this is something that we decided to do in support of the team. Otherwise, I think we are trying to be very flexible, but with all honesty, it doesn't matter how flexible we are. It is quite, I would say, pressuring for the consultants to be consulting other families, but in the same time to be a mother, a father, a relative, and a person in all of this. We adopted several interventions, psychological consultations for our teams, and of course for the families we support. And we had our first virtual team building online, which is also something that I would recommend. We had a homework task that everybody had to say what will be the first thing you will do after all of this is over. We had a little dress up before the actual team building, and it was, even though it's something very minor from an organizational point of view, especially if you have a big team who is used to being with each other, quite often these things really help. So that's also something that I wanted to mention. Let me just look at my marks here. How much time do I have more, Karin? Okay. The last thing that I would like to conclude with is that as an organization in this kind of crisis, I think it's very important to stay calm, because crisis like this, maybe this is the first crisis like this of this scale, but generally crises are part of organizational development. And each organization needs to have some kind of crisis response in a way that it's not only panicking. First, because as people who work with other people, if we project panic, that's what's happening within our team. And also, I think it's very important to say that especially people who work with disability or children with disability or children with special learning needs, this is generally a target group which really needs extra support in those kind of times. Of course, I'm not disregarding the families generally with children, but if you have a child in isolation with autism and you're in lockdown, that is very different experience than if you just have a child in lockdown. And of course, it's in all means very difficult. And this is also something that we try to tackle. For example, we started to do consultations generally for parents. Many people would write to us and say, my child is with no condition, with no disability, but I cannot deal with this anymore. What do I do? So we actually even started to work with more families since the crisis.
Now that was the finish, wasn't it?
by the look on your face, I would say that would be my line, yes.
Well, thanks a lot, Maya. And I think it was really very nice to hear also the details how you are doing it. Like you had already told us yesterday that this was a focus of you, and I think it gave a very lively picture, including the online team building experience. So thank you very much for sharing this with us. And so I would like to come to our last panelist, which is Milan Sverepa, who is from Inclusion Europe. And as Milan is representing a DPO, I'm sure his focus will be on what persons with disabilities would like to have or need from us service providers. Milan, please.
Good afternoon. Thank you for the invitation. I am the director of Inclusion Europe, and Inclusion Europe, we represent people with intellectual disabilities and their families. And obviously, that means that what I am bringing here is sort of the view of people with intellectual disability, of the expectations and some of the aspects of reopening or lack of reopening of services during this situation. And I think the lack of reopening would be one of the first things to mention from our point of view. In many countries, we still see that social services are not being opened or have not been considered into the confinement plans and measures, and it took a lot of advocacy work to actually ensure that they are at least finally considered and made part of the plans to start reopening the situation, and that would maybe formulated into the first expectation. I think in the dialogues that service providers have with the governments, they would advocate for the reopening of services, because these are obviously essential for people. It's been 2 months in many countries that the situation has been, the services have been under lockdown. That means 2 months for people with disabilities and for their family members without any kind of respite, any kind of support from one another. And that is obviously a situation that is potentially very risky for and very stressful, and can lead to very unpleasant results. I mean, advocating for actual reopening of services would be one of the key expectations of this time. Another, I think, is closely connected, and we can see from some other countries, like yesterday there was a news coming out of Finland, when the service providers are kind of going beyond the official guidelines and are preventing people with disabilities from seeing their families or other relatives or friends or whatever, even though they would normally be allowed to. So that, of course, is also something that needs to have a close attention, and to limit the period where people cannot talk to one another and cannot visit friends or families, to shorten that period as much as possible, and definitely not to go beyond the official guidelines and regulation issued by the government. Let's say another note is the aspect of actual reopening and the services being reopened and schools being reopened. Let's say people with disabilities themselves or their relatives being hesitant to use them for fear of exposure to the virus. Yeah, I think in most countries, when schools are reopening, there is a lot of news coming out that basically about half of the families are saying that they will not allow the children to go to schools because it's risky. I think it's similar case, maybe not such a high number, but it's still similar case and worries from towards social services. So what I would like to say in this would be to ask the providers that they need to be very proactive and reach out to those who are maybe hesitant to go and use the services at the moment, even though they would normally use them, because it's obviously, I can understand the worries and the health risks. We also need to see that the potential risks associated with not having a respite and not being able to take any time off, being cared for by a relative, or providing care as a relative. So I think a sort of more proactive approach and paying extra attention and trying to reach out to those who might be hesitant to use the reopened services would be also very important. And then, of course, there are, let's say, some of the more, let's say, practical aspects, some of the elements that you have that we discussed in the previous presentations, like providing training, extra training to deal with the current situation, to be able to work within the social distancing and protection measures, but also to use the new online tools and all of it. We see some countries where there is the governments provide special investment to public services, so they can do extra training and can provide extra equipment. So that's something that obviously would be very good if it was available for more service providers in more countries, because they, of course, need to adjust to this situation as well. Maybe just to mention and add to the practical elements, we also saw, for example, in Denmark, some of the service providers are talking about doing some floor signage, essentially, to lead people to be able to have conversations and kind of be in those service providers establishments. So there is some floor signage to mark how to keep the distance from one another while being able to talk to one another. And I'm mentioning it to just stress the importance of thinking of ways how to support the people using services in following the new rules. And that is, of course, that can take more than explaining those, but there can be these non-intrusive visual elements, like we experience them sometimes when we go shopping or something, that there are some marks on the ground to help us keep distance. So I think there are already emerging examples within social services as well, how to utilize some of these things, and that might be interesting as well to have a look at. To support people in actually being able to use the services while adhering to the regulations. And
sorry, Milan, could you conclude?
Yeah, I'm concluding.
Oh, perfect, thanks.
So, and of course, it's important to recognize not just during this reopening period and then the difficulties that it will bring for providers, but also going back to 2 months, that there has been a lot of effort and personal investment in many organizations put into ensuring that the services that were functioning, and that the people using them were being kept safe. So that, of course, deserves appreciation. So thank you for inviting me. I wanted just to highlight some of these points here, and that would be all from me. I'm happy to take questions.
Thank you very much, Milan. I think this was a very important perspective. First of all, our efforts in designing plans, how to restart the services and everything. I think you confirmed just how important it is by telling us that in many countries, still services are not available for persons with intellectual disabilities. Also the importance you put on us service providers reaching out and to motivate people that they dare to use services. And also what I found quite interesting is this experience that service providers can be quite overprotective, meaning that I think all of us were quite afraid of this pandemic, and also our governments set a lot of measures, but that we really have to keep in mind this balance between protection and also between living one's life by other things that are important to us. So thank you very much for drawing our attention also very much on these issues. And I'm looking at the questions that we received. And so there is a question, I think it's more for the service providers, and you can figure out who wants to respond. It's like, the question is in terms of risk assessment. How do you prioritize who of the service users will come back first to the services once you're reopening? You're not reopening for everyone at the same time, but kind of like, do you have a sort of risk assessment in your mind when you are deciding who comes back when? Maya, maybe you're already making signs you're willing.
Well, we had, that's a huge question, because it, especially when it comes to children, there sometimes is a sense of urgency for one's therapy regarding of the condition or the disability. So sometimes it is really easy to prioritize because you know that it's a matter of time that you're losing months. And especially, for example, in our early intervention team, sometimes we work with babies who are 1 week old. And you know, it is really crucial that you actually start within the first month or within the first 3 months, something like that. So if by any chance there is somebody in this situation, they will be the first one to come. Also, we had several families, as I mentioned before, we managed to convert most of our sessions online, but we had several families who are either living in really isolated areas without internet, or they are not very much eager to do the digital therapy or digital consultation. So with them, we have a separate plan of coming back, because we've been not in contact with them in quality manner for nearly 2 months. But we are trying also to discuss this very openly with the family, so they don't feel like that there are someone who is prioritized without any transparent rules. And I think the crucial part here is that you will have very visible and transparent conditions. Why and what do you take this decision? And of course, at the end of the day, it is the therapist and the consultant who are like summarizing the recommendation if somebody should come back in June with the first wave of face-to-face. Or, for example, there are families which really benefit a lot with the online therapy, and they're much active right now in the life of their own child because they feel much more empowered and they know much more. On the other hand, for example, if you have somebody who works directly with a physiotherapist and they need to use their hands, this online thing is not very well with them. So it's really a personal decision based on each case.
Thank you very much, Maya. I'm sure the others would have also contributions to this question, but I have a very interesting question still in my book here, and I would like to maybe address it both to Milan and Sylvain as an umbrella organization. And the question is that whether we could also look at the opportunities that this situation provided. For example, the opportunity to turn more towards individualized supports in the communities and turn away from supporting people in centers and like group homes or services like that. Milan, would you like to respond first?
Happy to respond on this topic in particular. I think if there is an obvious lesson learned, that's this one. Large-scale institution in particular are nothing but a melting pot and pressure cooker of problems and risks, and I think that was greatly illustrated by this situation when there is many people getting infected and many people dying in these institutions. And there is nothing the staff can do about that. And actually, that's down to the inadequate setup of those services. I also heard from many smaller residential centers in countries, especially those who were set up as part of the institutionalization effort, who basically were not affected by this situation at all. They just live in smaller, let's say, groups, or they provide individualized support. So there is no kind of exposure of such large groups of people, and never takes these extreme measures. So yeah, definitely that's one of the key lessons that anybody can see if they are willing to see them. And I just last bit on that, I think that we shouldn't fall into thinking that too many people are going to see that. It's clear. It was always clear to many. It is clearer now to many more, but I think there is also many other issues, and it may be more pronounced in our eyes because we pay attention and we care about these issues. I'm not so sure that it's much clearer to many others who are actually responsible for organizing social care and paying for social care. So I think in communicating these lessons, and on this topic in particular, would be very, very important, and maybe highlighting also the, let's say, the positive aspects of how the, let's say, the small settings, individualized support dealt in these circumstances much better.
Thanks a lot, Milan. Sylvain, one or two final sentences from the umbrella organization?
The key learnings, I think, have to come from the ground, and the providers have the best situation to collect and to make some conclusions. And I think to complete this work at the ground level, the umbrella organizations at national and also European level as EASPD are here to make everybody benefit from these good practices and key learnings from the ground.
Thank you very much, Sylvain. Well, it was a really interesting webinar, so many interesting inputs and interesting discussion, and it just flew by in terms of time. But I know that my colleague Luc is always rather strict about time. So I would like to give him the floor now for his observations and conclusions from what we heard so far. And I'm really curious to hear them. Luc, please.
Thank you very much, Karen. And I must say, you did an excellent job. 6 speakers and an audience of many hundreds of people that were following, more than 300 here, but many more through Facebook. You did a great job, Karen. Congratulations. And I also would like to thank the speakers, because what was brought up here, the topics discussed it was very, very rich. And I also saw in the chat box that the exchange is still going on. And that is why we organize these webinars. It is to learn from each other. It is to support each other. So thank you very much. The title of this webinar, the topic of this webinar is about restarting. And that might give the false impression that we are at the beginning of the end of this crisis. But that is not true. We are at the end of the beginning. We will have to learn living with this virus, I think, and it will have a long-lasting effect on our services and how we provide them. And I think that maybe the most positive news is that, on the one hand, services did not stop supporting people. They went digital, they went mobile, they were very innovative in keep on supporting individuals and families. Still, many others had to close, and they are now very eager to restart. But restarting is not that easy. As the speaker from the Commission said, social service provision is risky business. In some cases, even more risky than working in the health care sector. And why is that? Well, it is because working on 1.5 meter distance in our sector is not self-evident. The backbone of our sector is working closely together with people, having a relation, supporting people in many different ways. So it is not self-evident to implement what would make it maybe safer. But maybe more important than that is that until today, personal protective equipment is not yet available to all professionals, to all family members, and to all service users in our field. And that is a dramatic situation, and it is an unacceptable situation, and we should keep on saying this also to authorities. And in fact, what we see now is that the problems in the sector today are in a way magnified because they were there already. We work in a sector where we, since a generation, and in some countries even longer than a generation, had to face underinvestment. And now it becomes clearer that indeed this investment is absolutely needed. That's my first chapter of conclusions. Secondly, what do we have to do in the short term? Of course, protective equipment and the needed measures should be in place. And we have to talk about this. We have to talk about this as service providers, with the employees, with the workforce, but also with the people that we support and with the families. Talk, talk, talk. It is so important that we implement or restart our services in a well-considered way together with all other stakeholders. And training is needed. That was made clear by many speakers, I think. Training of staff, but also of the service users and the families. And it could be a very good idea to work with contact bubbles, and many other ideas were suggested in the chat box. Let's also not forget the psychological aspects of this type of work that we do. Burnout was discussed also in the chat box. Last but not least, of this first short-term restarting the sector, we always have to remember that a service is not functioning on an island. To get there, you need transportation. Food has to be provided. Therapy has to be provided. So there are many different aspects when we start providing services, and we have to see the full picture if we want to restart the machinery. Also, some clear points were made with regard to the long-term lessons that we can learn from this. First of all, working conditions. Working conditions are crucial, and social dialogue should be further developed. Risk management. What is our risk preparedness? Do we have plans in our sector? And that is a responsibility of us, social service providers. Investment in training and in staff development, absolutely essential. And we also have to invest in even better communication with service users and families. There were examples given by the speakers on easy to read and ways on how that can be done. Also, the way we provide services in different types of settings should be reviewed. Indeed, the Director of Inclusion Europe brought it up. Also, the size of the sector could be an important element. What I learned also from this discussion, and it was brought up by one of the speakers, social services are essential services. They, in a way, empower people, empower persons with a disability to take part in the life of society. And that is absolutely essential. Again, I would like to thank all speakers, but please stay with me for one more minute because I have some breaking news for you. First of all, next week webinar, Wednesday, the 20th of May at 2 o'clock, we have a webinar on cultural participation and how cultural participation, also in times of crisis, is very important for the people that we support. Most of you know it. We have, since 2 months now, a very active Facebook page where we exchange ideas and where we try to learn from one another. So please keep on using this Facebook page. And we also have a help desk to support our EASPD members in what they are doing. And now the breaking news. During one of the webinars of a few weeks ago, we in a way challenged the European Commission, saying that the Corona Response Initiative, the 37 billion euro that Europe has allocated to fighting against these crises, ESF money, ERDF money, so social fund money, we challenged the Commission and we said, this money is not reaching our sector. I have very good news. We will, together with the European Commission, organize a webinar on the 3rd of June at 10 o'clock, Wednesday, the 3rd of June at 10 o'clock, a webinar organized by the European Commission, EASPD and other actors from the social field to ease the access to these funds so that we can do what we have to do in a correct way, to cover cost for protective equipment, to cover cost for additional training, to cover cost for ICT material that we might need to provide services. So please pencil it in your agenda. Wednesday, the 20th, next week, we work on cultural participation. And Wednesday, the 3rd of June, a somewhat longer webinar organized in close cooperation with the European Commission services on how to get better access to this very important Corona Response Initiative fund. Again, Karen, thank you very much for the excellent work done. Thanks, speakers, and to all the participants. I would like to say, dear guys, let's keep on exchanging. It is good for the entire sector, and it is what is needed for the people we try to support. Take care and see you next week. Bye.
Bye. Thank you.
All right.